I think we've come to a renewed understanding of the impact of change and the tension between standardization and personalization. But what I want to talk about is actually how this change, this tension between personalization and standardization, has actually changed paradigms of care. Because ultimately, personalization of care for a patient isn't just an abstract idea. It's a matter of life or death. It's a matter of restoration to wholeness. It's a matter of a system that really marshals all of its resources in pursuit of bringing a person to wellness. And we can either do that well, or we can do that in a haphazard way. And part of that involves marshaling innovations in real time, in a high throughput way, and making them real for patients and families who need them. The key thing there is the personalization of that care. Now, why is that harder than it used to be? Well, we've entered an era of precision medicine. So things that we would have thought about as one cancer a decade ago, when you look at them very closely on a genetic level, you realize they represent hundreds of different subtypes of cancer. We have an extraordinary armamentarium that can be marshaled in dynamic ways if we know how to use that knowledge. And this is the challenge. How do you create a system of high throughput knowledge, understanding, and then marshal it to the needs of a patient in a family in a highly personalized way? Because the other thing that I'll lay onto this is that cancer care is not a technological experience. It's a human experience. We don't treat diseases. We care for patients and their families, because families are as responsible for good outcomes as any of the most critical elements of what we do. Now, our system isn't designed well to do this. They did not keep up with the pace of innovation. So our systems have an inertia of their own. If we're going to make sure that patients get best, most proper care, and that families are fostered through a decision-making process that is inherently, profoundly, arduously complex, then relying upon static things like guidelines based upon consensus of people who might not be aligned in the right ways, we have to get past those models of thinking. We have to find fast focus upon the patient and their family. I've just given you a rough overview of why personalization is really the new model for delivering care. There are elements that can be standardized, but what you can't standardize is this idea that each individual has to be evaluated, supported in a way that honors their unique humanity, is couched in a depth of understanding their family, their circumstances, their support systems, and that leverages the best and new emerging science to ensure that people get the most effective care in the most equitable, humanly and economically sustainable way possible.